Hello everyone, here is Dr. Benaduce. In this video, we'll go over the appendicular skeleton, specifically the lower limb bones and the pelvic girdle bones. Our lower limb is divided into three main regions. We have the thigh, we have the leg, and we have the foot. Together, these three regions form our lower limb. If we say the leg, we are not referring to the lower limb. We are specifically referring to the leg in anatomy. And the leg in anatomy is just the part of our lower limb that goes from the knee to the ankle joint. The leg has two bones, the tibia bone and the fibula bone. The thigh has only one bone, the femur bone. In the anterior aspect of the knee, we have the patella, which is the largest sesamoid bone in our body. When we look at the foot, we see 7 tarsal bones, we see 5 metatarsal bones, and we see 14 phalanges. The femur, tibia, fibula, metatarsals, and phalanges are all bones that are longer than wider. Consequently, they are all long bones. When we look at the tarsal bones, we see that they are very short and they are then classified as short bones. But when we look at the calcaneus, besides being a short bone, is also considered an irregular bone. So keep that in mind.